This article looks at the prevention, treatment, and management of sarcopenia, a condition which leads to loss of muscle mass associated with adverse muscle changes, which can be prevented and managed with physical activity and a healthy diet. It is the second in a series on sarcopenia, the first of which examined types, causes, diagnosis, and impact. This peer-reviewed article is read to you using an automated voice, so some of the words and phrases may not be as you would usually expect to hear them. The full version of this article, with citation, references, and illustrations, can be found at nursingtimes.net under the musculoskeletal and orthopedics category. It comes with a multiple-choice self-assessment which, when completed, contributes towards your continuing professional development and revalidation requirements. Subscribers to Nursing Times have unlimited access to all our current and archived clinical articles, including the CPD Zone, where you will find a range of online learning units on fundamental aspects of nursing. The article is written by Linda Nazarko, specialist frailty nurse at Sutton Health and Care, Epsom and St Helier University Hospitals NHS Trust. Introduction. Many people in the West are surviving into their 70s, 80s and beyond, but our knowledge of how aging and lifestyle affect anatomy and physiology is in its infancy. Sarcopenia is an important health problem that was accepted as a disease in the International Classification of Diseases in 2016. As discussed in the first article in this two-part series, sarcopenia is characterized by progressive and generalized loss of muscle mass and strength, and it leads to physical frailty, impaired mobility, and premature death. Preventing sarcopenia. Although sarcopenia is generally a disease of old age, it is rooted in adverse muscle changes that accrue across a lifetime. Not everyone ages at the same rate. An 80-year-old may remain robust and healthy, while a 60-year-old may need substantial care and support. People's health is affected by the conditions in which they are born, grow, live, work, and age, as well as their access to power and money. These social determinants of health affect lifestyle factors, thereby influencing the risk of health conditions, obesity, and mortality. In a cohort study of more than 135,000 UK adults with a mean age of 55 years from the UK Biobank study, Wang et al. 2023 estimated participants' cardiovascular health by assessing the following lifestyle factors: smoking status, physical activity, body mass index, diet, sleep, blood pressure, blood glucose level, non-high-density lipoprotein cholesterol. The researchers categorized participants into three groups: those with low, moderate, and high cardiovascular health scores. At age 50, men with high scores had an additional 7 years of life expectancy, free from chronic disease compared with those with low scores. In women, the difference was 10 years. Researchers found the gain in healthy life expectancy was very similar across all socioeconomic groups, which could be because the NHS provides equity of healthcare access. The causes of sarcopenia, discussed in the previous article in this series, overlap with the above list of lifestyle factors. Many of these can be modified through a person's lifetime, thereby reducing the risk of the condition or delaying its onset. Improving muscle strength. Most people are born healthy and gain muscle strength in early life. In adult life, the aim should be to maintain muscle strength. As adults age, muscle strength is lost. When it falls below a certain threshold, the person becomes disabled. Aging and age-related changes affect muscle function and strength. Between the ages of 25 and 80 years, aerobic capacity decreases by 40%. Adults also lose 3 to 8% of muscle mass per decade from the age of 30 years. In young, healthy adults, there are large amounts of reserve capacity, and each organ and body system is working at the highest possible level. As people age, there is a decline in function in all organs and body systems, and reserve capacity declines. When ability falls below a certain level, functional limitations occur. However, the expression "use it or lose it" applies as people age. Physical activity slows the rates of decline and improves quality of life, including reducing the risk of health issues. It also improves sleep and helps people to manage stress and maintain a healthy weight. People aged 65 years and older who are moderately active are less likely to experience physical and mental ill health as they age. Encouraging adults to remain active throughout their lives enables them to retain muscle mass and functional ability. A study by Heron et al., 2019, identified that inactivity led to more than 69,000 preventable deaths over a year in the UK. The Department of Health and Social Care's activity guideline states that adults of all ages should be physically active every day, but emphasises that any activity is better than none. It also stresses the importance of breaking up sedentary periods with periods of activity. For adults aged 65 years and older, the same guideline takes into account age-related changes and emphasises the importance of improving and maintaining physical function. In addition to recommended activity, it suggests that older adults do activities twice per week that improve balance and reduce the chance of frailty and falls, such as bowls, tai chi, and dancing. However, activity levels are falling in the UK. The population is 20% less active now than in the 1960s. Additionally, the Health Survey for England 2021 found that 33% of all adults aged 19 years and older were not meeting the Department of Health and Social Care's aerobic and muscle strengthening guidelines. Women were less active than men, and people became less active as they aged. Improving diet. As discussed in the previous article in this series, people with sarcopenia may be poorly nourished due to a number of causes. Some may be underweight and others obese. Both groups have suboptimal diets. Healthier diets can protect against and treat sarcopenia. These contain sufficient protein, vitamin D, foods with antioxidant properties, long-chain polyunsaturated fatty acids. Combining a healthy diet with exercise helps build and maintain muscle. Chang and Chu, 2023, reviewed 3 studies involving 637 patients to determine the effects of whey protein, leucine and vitamin D supplementation on muscle function in people with sarcopenia. They found that supplementation improved muscle mass, but exercise was needed to improve strength. Protein is an important part of the diet. The daily reference nutrient intake of protein for adults is 0.75 grams of protein per kilogram of body weight. This is 56 grams for men, based on a body weight of 75 kilograms, and 45 grams for women, based on a body weight of 60 kilograms. It equates to about 2 palm-sized servings of meat, pulses, tofu, fish, or nuts. Although protein guidelines are the same for younger and older adults, research by Bauer et al., 2013, suggested that older adults may need higher levels of protein than younger people to support lean body mass and function. They recommended that people aged greater than 65 years have a daily intake of at least 1 to 1.2 grams of protein per kilogram of body weight. Those who are active or who exercise may need 1.2 grams or more per kilogram of body weight per day. Those who are acutely or chronically unwell may need 1.2 to 1.5 grams per kilogram of body weight per day. Robinson et al., 2018, highlighted that further research is needed to determine how much additional protein older people need and whether increasing protein intake has any adverse effects. The body can make use of protein more effectively if intake is spaced out throughout the day. However, in the UK, most protein is consumed in the evening. Simple changes can help spread out protein intake, such as having eggs or high-protein yogurt for breakfast and snacking on high-protein foods, such as hummus. Treating and managing sarcopenia. There are not yet any medicines to treat sarcopenia, but Regenster et al., 2021, reported that more than 460 drugs were, at the time of writing, being trialled in an effort to find effective drug treatment. Sarcopenia is both under-recognized and poorly managed in clinical practice. Sarcopenia can be life-changing. It can affect balance and increase the risk of both falls and the fear of falling. It is also associated with impaired mobility, which leads to decreased venous blood flow. This can cause hypercoagulability and inflammation. It also increases the risk of deep vein thrombosis and pulmonary embolism. Management of sarcopenia is determined by its cause. People who have primary age-related sarcopenia are treated with both of the following: exercise and physical therapy that aim to strengthen muscle, dietary changes that aim to improve nutrition. People may also need help and support at home. Indeed, because they might struggle with activities of daily living, people with sarcopenia may become dependent and need long-term care. Secondary sarcopenia occurs when other factors, in combination with or unrelated to aging, lead to muscle wasting. These factors are discussed in the previous article in this series, but include organ failure, inflammatory diseases, cancer, endocrine diseases, malnutrition, possibly due to gastrointestinal or psychosocial disorders, inactivity, which may be disease-related. Treatment for secondary sarcopenia involves treating the primary illness and optimizing function. Exercise, physical therapy, and dietary interventions should then be undertaken. Anton et al., 2018, conducted a literature review of 19 studies that tested the impact of exercise and nutritional interventions for people with sarcopenia and/or frailty. They found some evidence of their effectiveness, although the findings were inconsistent. The review noted that existing evidence is based on populations that differ in age, frailty, and nutritional status, making it difficult to draw clear conclusions. They emphasized that further robust research is needed. Prevention is better than cure. Aging is associated with a decline in health and ability. In the UK, 44% of adults aged 66 years or more are classified as disabled, and 48% have mobility problems. In older people, poor physical health affects quality of life and leads to frailty, increased risk of disease, and increased healthcare costs. Among this population, sarcopenia is also associated with impaired cognition and may increase the risk of dementia. However, Starthy et al.'s 2022 research showed that older people at risk of declining mobility can benefit from modest amounts of physical activity. Therefore, there would be value in public health programs that improve health throughout an adult's life. As the UK population ages and activity levels fall, an increasing number of people will be at risk of sarcopenia. Clinicians need to be able to advise adults on remaining active and eating well. Prevention and early detection can improve the lives of people who are vulnerable to sarcopenia and other related conditions. Conclusion. Sarcopenia is an under-recognized condition that can impair quality of life. Physical activity and nutritional optimization can not only prevent sarcopenia, but can also be used to manage the condition when it does arise. Key points. Sarcopenia develops as a result of adverse muscle changes over a lifetime. Physical activity and a healthy diet reduce the risk of sarcopenia. Sarcopenia can be life-changing and is under-recognized in practice. There are not yet any medicines to treat sarcopenia, but drugs are being trialed. Treatment consists of physical therapy, optimizing nutrition, and treating contributing factors. Now you've listened to the article. Test your knowledge with the Nursing Times self-assessment. If you score 80% or more, you will receive a personalized certificate that you can download and store in your Nursing Times portfolio as CPD or revalidation evidence. The full version of this article, with references and illustrations, can be found at nursingtimes.net under the category Musculoskeletal and Orthopedics, along with our AI search facility, Ask Nursing Times, which allows you to explore the subject further. Thank you for listening.